Clearly, this is a man-made epidemic, and I think that there's going to be a lot of solutions that we can come up with. And as the evidence grows, I think there'll be more and more ways to basically get this under control. I mean, whether it will happen quickly enough, I wish the response would have happened a little bit earlier for the current epidemic we're in. But it's not like the first epidemic we're going to face. I mean, there's so many different drugs coming into the market. It's likely that we'll see another epidemic of something in the future. I mean, the same can be true for infectious diseases. I mean, we have Ebola, and if we think it's the last we've seen of Ebola or something like it, then I think we're delusional about that. And I think what we need to do is make sure that we have the surveillance tools that can kind of pick up these emerging outbreaks, and make sure that we have the capacity at the state level and at the local level to respond when we are seeing changes. I mean, you got to remember when Kay was first looking at this problem, she saw this little bleep very early in the epidemic, and had things been addressed and responded to appropriately at that specific time, it's hard to know what the epidemic would have looked like. I mean, it took another 5 years to really kind of banging the pots and getting people mobilized to even get it to the point where resources were being dedicated to it and national programs are being created around it. So hopefully, the one thing I hope in the future is that, we'll be a little bit more nimble the next time we see something. And, again, we're seeing kind of increases in heroin. So how are we going to respond to that? We have some of the same tools. Can we apply some of those same lessons and same tools to the increases in heroin? If it then pops up and we're playing whack-a-mole, are we going to be able to go and respond to, a different type of response that's needed for overdoses?